The health department in Dallas County is planning to identify public and private schools with low vaccination rates while they are monitoring this disease. Director for Dallas County Health and Human Services, Dr. Phil Huang, joins us this morning. Thanks for being here.
Sure, thank you.
So, kids are about to go on spring break. Families may be traveling. What should they know about measles when they do that?
Well, the most important thing is just make sure you're up to date on your vaccine. We have a very effective and safe vaccine, which is the reason measles was declared eliminated in the United States in 2000, and why we haven't seen it. Most physicians around have never seen a case. I've never personally seen a case, but it's because that vaccine works and it's safe and effective. And so if anyone, needs to make sure that they're up to date on that.
Is that something you could just go to your local pediatrician? Or so say if you are traveling and you want to do it quick, where do you get it?
Well, if you're going traveling, you need to try to do it before you travel, especially if you, and would really reconsider if someone's not vaccinated, would not recommend going to any of these areas where there's active measles going on or international travel. But we offer it at our clinics. I know some of the other health departments, physicians, it's readily available.
So call you guys.
Yeah, we've got it.
Doctor, what do you make of politics around vaccinations and the impact it has on a situation like this? Last week we had a group Make Texas Healthy Again, and part of their priorities was vaccine choice. So what would you tell families who are considering not getting vaccinated?
Bottom line, we're trying to protect the kids. It's tragic that we've had a death in a child already with the outbreak in West Texas, because it's entirely preventable. And I think all of us need to focus, it's to protect the kids, and the vaccine is what will do that. And we know it does that. We've had the success with this, and so it shouldn't be a political issue. It should be based on the science. So
for adults and for older adults who maybe can't remember if they got vaccinated as a kid or not, what should they do?
So actually, adults that were born before 1957 are considered protected and don't need to even reevaluate that because it was so widespread and it's so easily spread, they're considered that they don't need any more protection. There is a period between 1957 and 1968 that there was one dose of an inactivated vaccine that was administered, but it was actually only 5% of it, so that's even a very low risk. As long as you had that record of, if you have a record of 2 doses of the measles vaccine, you're protected.
And if you are older and you had measles as a kid and you remember it, do you need to get vaccinated?
No, you don't need to be vaccinated.
How are you watching for this disease? I'm sure you're talking to the people in Gaines County and down in the South Plains, but just 101, how do you monitor such a big county like Dallas?
Sure. Well, one of the things, that we learned from COVID, had been underinvestment in some of the data reporting systems and things for COVID, and it was so important, the numbers being accurate and timely, and we had stacks of paper faxes and med students manually entering in this data and people were saying, are the numbers going up? Are they going down? And it was based on this stuff, and it was on these paper records. And so we've really modernized. We're getting electronic lab reports. We're getting electronic case reports from electronic health record systems and all of that. And then so that's part of the system to look at any lab reports. But it's really that communication also with our healthcare providers. We've had communication. We've had a conference call and sessions with all the school health nurses and school health providers last week. We've had a session with all the infection control practitioners and physicians to talk about the protocols, how to recognize measles, because again, most physicians and most healthcare providers have never even seen it.
It sounds like COVID has actually prepared you for something like this.
Well, again, there were a lot of lessons learned from COVID, and it demonstrated there had not been adequate investment in the public health systems. There were investments in health, and when people talk about health, they're always thinking about like hospitals and doctors' offices and things, but not the public health, which is all of this together. It's, so one-on-one medicine, there was investments, but not for protecting us as a public.
In a few seconds we have left, it's measles today. Are you worried about diseases of yesteryear, chickenpox, whooping cough, making a resurgence as well.
Well, again, these are very preventable. The vaccines work, but because of things like COVID and some of the politicization, and it's also we're a victim of our own success because no one's seen, people haven't seen it, and they start to say, well, I don't see it. Why do I need to get a vaccine? It undermines that message about why it's still important to get the vaccine.
Okay.
Dr. Philip Huang, the Director of Dallas County Health and Human Services, thanks for being here.
Thank you.